For the first time in almost 2 months, South Korea has reported fewer than 100,000 new cases of COVID-19. Community health centers from today have stopped providing free rapid antigen tests, so most people who want one will have to go to a hospital or clinic. The government's also looking at how it's going to ease the distancing rules, though some rules will remain to protect vulnerable groups like the elderly. Shi-hoo reports.
As the Omicron wave of COVID-19 subsides, the number of new infections reported in South Korea has dropped to below 100,000 for the first time since late February. On Monday, new cases came to 90,928. The highest number of cases was in Gyeonggi-do Province with over 25,000, followed by Seoul. On Monday, the authorities started to discuss new changes to the social distancing measures. The so-called post-Omicron measures, it seems, could do away with many of the current rules, such as a limit of 10 people at social gatherings and the midnight limit on the business hours of restaurants and cafes. Any changes will likely take effect after the current policies expire on Sunday, April 17th. Also, President-elect Yoon Suk-yeol's transition committee has started work on what it calls a 100-day roadmap for COVID-19. The aim is to drastically change the COVID-19 response system within 100 days of Yoon taking office next month. Also on Monday, community health centers and testing stations have stopped providing free rapid antigen tests. Now they're offering only PCR tests and only for people in groups considered high risk. Everyone else needing a rapid antigen test will have to get it at a clinic or hospital at their own cost. Although the distancing rules will soon be eased, the government will keep restrictions on facilities that house the elderly, like nursing homes. That is because despite the downward trend in new infections, around 200 to 300 deaths are occurring every day. Most of these deaths are occurring among people 60 and older, who also account for around 20% of new cases overall. As of Monday, the cumulative COVID-19 death toll is at 19,679 and is expected to top 20,000 on Tuesday. Shi-hoo, Arirang News.